everyone, this is Dr. Siddharth here. I'm a multi-organ abdominal transplant surgeon and I'm working as a consultant at liver transplant. Today I thought I will talk about something which a lot of my patients have common as questions. Most of my patients who come to me are having advanced liver disease, and most of the questions are pertaining to what is liver failure, what is cirrhosis, and why do they need a liver transplant. So I thought I'll talk briefly about it today on a common forum. So starting with what is cirrhosis and what is liver failure. So first we have to understand that liver, though it is a solid organ, it is a soft organ, and when a liver disease sets in cirrhosis sets in for any particular cause, with cirrhosis we mean that the liver is getting hard and firm and shrunken. And a lot of patients with cirrhosis may not immediately need transplant if the cirrhosis is in the early stages. Cirrhosis simply we can divide based on few tests and patient's clinical condition as A, B and C, A being least severe and C being the most severe. When patients are in stage A, they may not require transplant. When they enter B or C, most of them do require transplant and benefit from transplant. And we say that the patient has liver failure when the signs of liver failure in a cirrhotic patient start appearing. So what are the signs of liver failure? Liver failure, most of the signs appear because the functions that the liver normally does are not able to be performed in the body, and second is something because what we call as portal hypertension. Portal hypertension simply means that there is a portal vein which normally drains blood into the liver from the intestines. Now this soft organ, soft liver, which has now become hard and shrunken, it provides a lot of resistance to that portal vein and blood is under a lot of pressure now. So these small veins which come from the intestine and form the big portal vein, they are also under a lot of pressure, and then because of the increased pressure they can burst and bleed at some point, and it can present as bleeding with vomiting. So this is one of the features of portal hypertension. Other features of portal hypertension are forming ascites, that is fluid in the abdomen. The features or the signs of liver failure per se are very easy to remember. We have to just remember that it can affect, because the liver has so many functions, that it can, liver failure can practically affect all organs. It can cause encephalopathy, that is drowsiness or seizures or even coma, because it can affect the brain. It can affect the lungs. It can cause a lot of fluid accumulation around the lungs. It can cause difficulty in oxygenation of the blood itself, which goes to the lung for getting oxygenated. In advanced cases and in a very minority of cases, it can also affect heart in certain ways. One of the most common organs to get affected by liver disease is kidneys. People may have normal kidneys, but because of the liver, the kidneys start getting affected. Yes, there is pooling of fluid which is known as ascites in the abdomen, and this ascites itself poses a risk for renal failure and poses a risk of getting infected. And once the ascites gets infected, it also becomes a life-threatening condition. So coma, heavy bleeding, infection in the ascites, renal failure, all these present as signs of liver failure, and they all can be life-threatening. So when these signs start appearing, that is the time when patient will benefit from liver transplantation. In common terms, what is liver transplantation? Well, we are taking out the deceased liver and we are putting in a new liver. So this is liver transplantation in very simple terms. A new healthy liver is replaced by an old deceased liver. So let us just briefly also discuss about what are the common causes for liver failure. As you all must have heard about hepatitis B and hepatitis C. Alcohol is something that we all are aware is a common cause for liver failure. What I would like to touch on today is something called NASH, which is non-alcoholic steatohepatitis. Something it is different in the terms from other causes is that it is neither a toxin nor an infection. Hepatitis B, hepatitis C are infections. Alcohol is a toxin. NASH is something which happens because of bad metabolic condition or something called metabolic syndrome, where patient has obesity, diabetes, thyroid disorders, deranged lipid profile or deranged cholesterol levels. So all these add as a risk factor for liver to have initially fatty liver, which in turn over the years or decades can turn into cirrhosis and liver failure. And this in developing countries like India and in developed countries is probably one of the fastest growing causes for liver disease. So next we come to what is the treatment. So in early cases of liver disease where the cirrhosis has not set in or patient is child A, there are certain, in fact, most of the causes for liver failure can be treated. Liver is one organ where most of the causes for end stage failure are actually preventable, and if identified at an early stage are treatable. We have very good medicines for hepatitis B treatment, for hepatitis C treatment. NASH, I said, is not an infection, is not a toxin. It is just probably our poor lifestyle habits, our poor diet, and chronic conditions like diabetes, thyroid disorders that over a long period of time can cause this disease. And once if we try to prevent these diseases, we can prevent liver failure from happening. Alcohol as a toxin can be avoided by a person if taken in moderation and small amounts. It may not cause liver failure, but it causes liver failure only when taken in very heavy amounts for a long duration. So most of the liver failure causes, the common causes, are very easily preventable. But once this treatment or medical treatment may be limited to conditions, as I said, in early liver disease, but once the liver disease becomes fairly advanced, where all these signs that I discussed earlier start becoming evident and keep happening over the course of time, this is the best indicator that patient now needs a liver transplant. We have objective markers, scorings, where we can calculate even the patient's proposed survival or predict patient survival over 90 days based on how advanced the liver disease is. Once the liver disease is advanced to a certain degree that it poses a threat to life, and liver transplantation will eliminate that risk, that is the time when patient will benefit from this surgery. And it is proposed only to these subset of patients where this liver disease is very, very advanced. Next common question is, what are the options for liver transplantation? Options for liver transplantation are commonly of two types. There are 3 or 4 different types of options, but the common beings a live donor and a cadaveric or a deceased donor. Live donor is one where a live person donates part of their liver, and cadaveric or deceased donor is where there is a person who is brain dead, is in the ICU setting, brain dead commonly because of a road traffic accident or a stroke, where all other organs are functioning normally, but the recovery of brain has been ascertained to be irrecoverable. And if the family members of these brain dead patients can consent, then these organs can be utilized for people who need those organs for transplantation. Both kind of liver transplants do happen in our country. So the next common question for patients with advanced liver disease who need transplant is, what are the options for transplantation? The two common options are live donor transplantation and cadaveric transplantation, or organs from a brain dead patient. Live donation is where somebody live donates part of their liver. In India, what is allowable is that they have to be a blood relative or a close contact of that patient. Live donor is safe in the terms of donor safety and the recipient safety, and the liver is unique in the capacity that it grows back to its normal size in 4 to 6 weeks in the donor and the recipient, and they both end up with a complete liver after 6 weeks. And donor can live a normal life. They don't need any lifelong medications. There is no restriction of physical work, mental work, or any kind of work that they may like to do in long term. So the next option is cadaveric transplant, where a brain dead patient donates organs. These patients are usually those who had a road traffic accident or a stroke, and their brain has received damage which cannot be reversed, or the recovery is not possible, but all other organs are in working condition. The heart is pumping, the blood circulation is there, and the major organs like lungs, kidneys, liver, small bowel, and all other major organs are in working condition. So these patients are usually in the ICU. They are usually on a ventilator. When their family or next of kin gives consent, then these organs can be used for patients who need it for transplantation. So these are the two broad categories, life versus deceased. In terms of outcomes, the outcome of both type of transplantation is comparable in long term. Yes, in live donors, patients, because they are receiving a part of liver, initially the hospitalization period may be a little longer by a few days to a week or so, but in the long term, they both type of recipients from live and cadaveric, they both do similarly in the long. So this in nutshell is what is liver disease, and patients, who are the patients who require liver transplant, and what are our options. And if you need any further clarification, you can always get in touch with me through Lybrate or through my email ID. I'll be more than happy to answer any questions. Thank you.